drama and tension. Even though the president's party holds the majority in Congress, expect a rough road overhauling health care. So who stands to win and lose based on the plans floating around on Capitol Hill? Michael Waldholtz is the managing editor of Bloomberg's health team, and he joins us now. Michael, 45 days. They're trying to get this done in 45 days, transforming an industry that has sort of evolved over such a long period of time into such a mishmash, really. Explain to us, our viewers really need to know, where are we right now in this debate?
Well, I think, just step back, exactly what you're saying. What we're going to be witnessing, if you have the fortitude to witness this in Congress, is nothing less than an overhaul of a sector of the economy that represents about 18% of the GDP. And it's clearly the most ambitious effort since Medicare and Medicaid were created in 1965. And as you say, it's in record time. They want to do it before the August recess. No one wants to wait until the fall. There's too many other things to go on. And if it goes on to next year, it's congressional elections. It'll never get passed.
Now, there's more than one bill floating around, right? The president's proposal, I guess there's the House has its own, the Senate has its own. What are the main differences between all these different pieces of legislation?
The president has been careful to hold back. He had some main ideas, and they're going to be presented in the House and the Senate. Senate had a bill last week that they had to pull back because the Congressional Budget Office determined that it was way too expensive. The really expensive part is this idea for a public plan, something the government would provide to help cover the 47 million uninsured. It turned out it was way too expensive. The Senator Baucus, who's the Democrat from Montana who presented it, has pulled it back. He's now negotiating with what's being called the coalition of the willing, some Republicans, to try to come up with a better plan. That'll be presented this week. The House came up with its plan. It's much more liberal, but it also has a public proposal. Other elements of the plan, though, would be a requirement that employers cover most of their employees, and also that individuals cover it, get covered. There's another very contentious part of the bill, which would require that folks like you and me might have to pay taxes finally for our employee health benefits. That's going to be something to closely watch.
And another contentious issue, the idea that some companies, at least as long as they have revenue up to a certain point, would have to cover health care for all of their employees, right?
Yes, or in the House bill, pay a penalty of 8% of their payroll.
Investors look at this debate. They're trying to hash out who the winners and losers are going to be. Do we have any sense right now as to whom they might be?
Last week was a real interesting indication when it looked like the Baucus plan, which proposed this public insurance program.
This is the Senate bill.
This was the Senate bill. Was on the was being pulled back. The managed care companies, Aetna, United Health, that sector went up by about 8% last week. Now it could go back down this week if it looks as if that plan is back on board. The drug companies over the late in the week and over the weekend negotiated a deal with the administration that may avoid them having price controls. They're trying to limit the amount of money that elderly pay in Medicare. And so we may watch their stocks go up today, in fact. I think the other thing for us to watch for people with a really rich employee health benefit is this tax. I think that's going to be a big issue.
Is the status quo, the more the status quo stays, is that effectively a win for healthcare providers, drug companies, et cetera?
Yes, the status quo for investors would be. I think for the rest of us, it's a real problem. As I said, it's 18% of the GDP. It's threatening to go up to 34%. There has to be something done for the 47 million uninsured. This can't stay, at status quo, except, I've watched this before. I wouldn't be surprised if nothing happens.
Even though the public opinion polls say that people are willing to pay for it.
Everybody wants something.
All right, Bloomberg's managing editor for health, Mike Waldholtz. Thanks for joining us, Mike.
Good to be here.